Hi, my name is Danielle Pike. I'm a registered nurse working in the St. Paul, Minnesota area, and I started getting involved in my community assisting individuals experiencing homelessness in high school. Homelessness is a condition in which an individual or family does not have a permanent dwelling. People experiencing homelessness can face several challenges. I will be discussing a way to alleviate these challenges for this population through the Ending Homelessness Act of 2017. I would like to connect with other healthcare professionals, legislators, educators, and those involved in the fight against homelessness. I would also like to see this bill get passed and become law to provide relief to this population. Homelessness is a complex issue and can be caused by several different reasons. The main causes of homelessness are the lack of resources, including affordable housing, health services, and supportive services. In addition, poverty, availability of work, and insufficient income and violence play a role as well. The population experiencing homelessness faces basic challenges involving safety and security, physiological needs, cleanliness, hygiene, navigating the system, and social isolation. So as we dive into the history of homelessness, we will discuss different periods in time and how they have influenced homelessness. Pre-Civil War or industrialization had individuals without adequate housing that were affected by the war, expelled from towns, or immigrants looking for settlements. Most individuals looked for wage labor, which unfortunately was easily replaceable, making income not reliable. Post-Civil War had an influx of freed slaves and veterans from the war looking for jobs, which was an unstable workforce that was unregulated. The Great Depression had substantial negative impact on the U.S. economy and the lives of many individuals' livelihood. Individuals experiencing homelessness began to spread to whole families and produced misplaced communities on streets and skid rows where these individuals congregated. This period resulted in homelessness becoming a widespread issue across the nation. In the urban renewal period, there was the development of new housing regulations that increased the safety in many buildings. However, this created more expensive housing and less options for those experiencing homelessness, creating an even larger gap. Around the 1970s, there was a shift to create more shelters and organizations to serve the homeless population. Federal homelessness assistance was created and the right to shelter was established. Yet there were episodes of budget cuts for these social programs that only created a larger gap for those experiencing homelessness to get some relief, which created the chronic homelessness issue today. In the United States, each given night, there's approximately 553,749 people experiencing the unfortunate events of homelessness. This means there's about 17 people per 10,000 people experiencing homelessness. The rates of homelessness have increased from 2016 to 2017, which has not occurred in the last 7 years. About 34% of the homeless people have lived in an uninhabitable place. Individuals account for 66.7% of the people experiencing homelessness, and families account for 33.3%. The Ending Homelessness Act of 2017 focuses on amending the McKinney-Vento Homeless Assistance Act. Specifically, this bill will create emergency relief grants, provide rental assistance, and deliver outreach services. Additionally, funds will be provided to increase homeownership and supply rental housing. Families will only be required to pay less than 30% of their total income for their rental housing. Funds will be distributed to Medicaid programs, housing providers, financial services, and mental and behavioral health providers. The bill will create permanent housing assistance programs and create the U.S. Interagency Council on Homelessness. As you can see, there is a list of multiple stakeholders for this bill. These stakeholders include the U.S. Department of Health and Human Services, the National Alliance to End Homelessness, United States Interagency Council on Homelessness, law enforcement, school officials, shelter operators and administrators, housing administrators, the Coalition for the Homeless, outreach organizations, hospitals, and healthcare professionals. There are also allies noted from the U.S. House Committee on Financial Services. The National Alliance to End Homelessness helps advocate for improved federal homelessness policy and legislation. The Corporation for Supportive Housing works to advance housing solutions, improve public resources, and build better communities. The National Low-Income Housing Coalition is dedicated to improve public policy for low-income individuals. As a healthcare professional and a future nurse practitioner, I strongly support the passing of the Ending Homelessness Act of 2017. Providing assistance and relief will help decrease and aid in eliminating homelessness. Success of this bill will be shown through the reduction in the prevalence of people experiencing homelessness and their use of the resources this bill offers. The public would benefit from safer communities, long-term reduction in healthcare costs to the public, and meeting the needs of this population. The bill has the power to decrease the prevalence of poverty, unemployment, and homelessness. This bill could reach individuals, youth, families, and veterans, meeting the basic needs of those experiencing homelessness by providing housing, focusing on education, and offering supportive services would create a safer community for all.